Mr. Felix Koskei, my sister CS Susan Nakumicha, principal secretaries who are in that docket, my sister Mary Mudhoni, PS Haliki Mutai, my PS Veronica Duva, PS for crops, and I think PS for interior is also here, but he has not been mentioned so that we don't scare you. Ladies and gentlemen, good afternoon. I'm very privileged and very pleased to be here to witness this very important dialogue and conversation around our health issue. One of the things that make me very happy, I was just whispering to Senator Mandago here, is that for the first time in a long time, this country is now focusing on issues. We have so much conversation, we have so much of discourse on issues that affect this country. In the previous years, this kind of conversation was unimaginable. But now that we are here for a whole week talking about health, it is something that is really, really, truly very encouraging. When I look at health issues, I want to compare it with a car. Let us assume our bodies are motor vehicles. So to talk about a car, if the car is broken, we need three things. We need tools and commodities to be able to fix that car. And of course, we need money to fix the car. But more important is that we need a mechanic. And a mechanic, without him or her, the tools, the money is irrelevant. That is why I want to applaud this coming together of you people whom we depend on. You know, gari yako ikikwama, sometimes we can try and fix it. When your house is leaking, you can try and do it yourself. But none of us can be able to treat ourselves. And I saw it during COVID, when as a COVID survivor, I was sharing the ward with very highly qualified doctors. And I asked one of them, Daktari, kwani daktari anagojeka? And it was actually humbling that even a doctor would require another doctor to treat him. So you are all very great people, and you are very important people and very special people without whom we can't work together. Let me start first by applauding the great work which my sister and the team are doing in this space of healthcare. Actually, let me say, because I've been around for some time, the amount of work that has been done within our health space for the last 11 months is equivalent to some 20, 30 years of work there before. I know that could not have been possible without cooperation from all the players, as cabinet. Every other day we have something that we are discussing about healthcare. And in this regard, I also want to thank especially the unions. You know, I asked Susan yesterday when she insisted that I must come here. Are you sure it is not going to be a fight with the unions? And I'm delighted when I saw my friend Washira here, very calm. You know, before I came, I was doing some pleasure. I only came because I was told Panyako is away, but let me say that it is really, 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 truly inspiring. Some jobs you can't do for the sake of a job. Some jobs are beyond a job. Some jobs is a calling. And the kind of work that you people in this space do is truly beyond a job. So let me first encourage our unions to really stay on that trajectory of engagement, of constructive, positive engagement, because they are your patients, they are your mothers, they are your fathers, they are your husbands, your wives, your children. We don't have people belonging to unions and others belonging to government. We are in this together, and we should stick together. And I know, as a cabinet secretary in charge of public service, that there are some outstanding issues there, issues to do with especially the collective bargaining agreement. And I know that that's a conversation we have to continue to have. But that conversation and that engagement must continue to be driven by the values that we have got a shared destiny and a shared responsibility. We cannot achieve it as government alone. You cannot achieve it alone. So Susan and the unions, please stay on that trajectory. And now, as your minister, I want to offer myself, because I think I've got some few skills there in trying to achieve some consensus. I'm a certified dowry negotiator. And I can be able to assist you with some of the experiences to ensure that our CBA remains on course, and to ensure that that ultimately we do what is good for everybody. But essentially, we do what is good for the people of this country first, given our current situation, given where we are, and I'm very pleased that I'm actually preaching to the choir, because I'm advised that the unions are already in that trajectory. When on that, let me say that, and I've talked to the CEO of the Council of Governors, Mary Muti, who is here, and Susan, in the next 2 weeks, I would really want us to have, a conversation with all the governors together with my ministry and your ministry to really look at this issue of harmonization. Because I know it's a sticking issue. Yesterday, I got an SMS message from some health worker, I think it's a nurse, in my county of Kiambu. And, it was really heart-rending when she told me that she is we have got 3 people doing the same job in that facility. One is a casual, the other one is a contract worker, the other one is a permanent and pensionable, and they are being paid differently. And I want to agree with Wazishira. That is a question of social justice and social equity. It's a question of a human right there. When you have people who are doing the same job but are being remunerated or treated differently. I'm aware that in the previous government, when we tried to implement the universal health care, and we left some orphans, some 8,000 or so orphans who are trained on UHC. And now, and a senator, that is something I would really want you to discuss within the Senate, and I want to ask Council of Governors to also take it up. It does not make sense for us to go out there and recruit somebody when there is somebody who has been trained, we have invested in that person, we use money, not our money from our pockets, but money belonging to the taxpayers of this country to train those people. So please, the sensible thing is, before we hire other people, can we ensure that these people whom the country invested in, we are able to deploy them, work with them, and then create space for us to be able to train other people. There's something also that I want to add here from the point of view of performance. The whole issue, now we are very focused as a government on the issue of performance and delivery. And all of us have signed a performance contract. But our people in the counties are outside of that performance contracting regime. Unless you tell me they are going to be paid by money coming from elsewhere. But if they are going to be paid by these taxpayers, it is about time that you people, the people of Kenya, demands that everybody, whether you are in national government, whether you are in county government, you must sign a contract with the people of Kenya through performance contract. Within government, they have got their own TORs, their own deliverables. Someone is a driver, someone is a mechanic, someone is a cleaner, and they have a contract, and they are being measured. Yet we have got a highly qualified doctor, a physician, in a county hospital who is not on performance contract. That is not right, and it's not fair. So we were going to work together to ensure that even senior people, senior doctors within brought into this particular regime. Susan, let me also congratulate you for the, that you've brought, focusing on the other elements, and especially giving some sense, one, to this whole architecture of having the primary health care under the Afya Nyumbani architecture. That for the first time now, we can have a level 4 hospital sponsoring a level 3 facility or sponsoring a level 2 facility. 90% of the problems of healthcare that we face can be finished at that local level, at the level 2 level and level 3 level. But we need to invest more to transition our people's mindset. There's a time where I come from, unless you go to Kenyatta National Hospital, you've not seen a doctor. And times have moved. So we need to work together to actually sensitize our people to agree and to appreciate that does not matter where the health facility is, as long as you get the service. And that is why I'm very much excited about your facilities bill that you put in Parliament, the social health financing, and also the digital health that has now been passed by Parliament. Finally, let me talk about this issue of financing. The biggest problem we had in the other government is that we tried to blanket everybody together, even rich people. We were doing a pilot in a county called Nyeri, and we were telling someone, a rich farmer in Odhaya, please put back your tip bonus money to your pocket. Government will pay for you. That person did not say us to pay for him. That person did not tell us that they have a problem paying. But the way your team has structured the social health insurance is really remarkable. And I'm sure we are going to start seeing the benefit, within the next 1 year. And somebody here has spoken about mobilizing farmers, mobilizing cooperatives. You and I were working on an initiative which we are going to continue for our border sector, a sector also which is unfair. When you talk about the issue of adverse selection, it is affecting a sector like border more than the other sector. These young men, mostly men, when they have accidents, they go to hospitals. They cannot be covered by NHI for the plate, ile chuma ambao wanawekwa. And really, I am only for that. I'm very passionate about the social health insurance so that we can eliminate this issue of adverse selection. Good people, it is a privilege to serve. It is a privilege to be in public service. And as I've said before, most of us are not in public service. We are in public employment. We're just employed by the public. And we need to have a conversation with ourselves. How can we transition from being in public employment to being in public service? It starts with this kind of conversation, working together, and knowing that we have got many more reasons to work than a salary. For me personally, the primary reason I work hard is what I go to heaven. So give yourself a reason for why you need to work hard. It can't just be a salary. It cannot just be to please your boss. Some of these things that are calling to public service requires a higher calling. And finally, Susan, I have a problem I want you to assist me with. The issues of disability. in this country are very serious. We have to act together to make life bearable for people who are living with disability. But there's a special phenomenon. An head of public service is here. I'm working on a report. You know, there are some things which are uniquely Kenyan. Within my first 1 week as a minister in charge of public service, I've discovered that Kenyans are getting disability, most of them at the age of 57. Mtu akijua retirement age inakuja karibu, all of a sudden wanakuwa na disability, wanakibia pale, wanapewa ka certificate. Now who am I to say whether they are actually disabled or not? I can only depend on you guys as professionals. But me, I think there's some, kuna ukola hapo ndani yake. And I want to tell the public servants, please, wacheni hiyo mchezo. Miaka yako ya kuritaya, enda nyumbani. And I'm now here to assist you to make that transition smooth. But this thing of someone, amebakisha mwaka moja, miaka mbili, anakibia pale kwa Council for Disability, anasema unajua hii jicho jana, haikuona mamangu vizuri, kwa hivyo, nipatie hiyo certificate. No, hiyo ni ukora, and we must live through to the spirit and the values of the public service. So with those few remarks, let me take this opportunity to invite the guest of honor, the head of public service, Mr. Felix Oskey, to address us. Thank you.